So we know that kidney stones, they can become a very big problem for many patients. And in this patient, our beloved Dr. Mohsin, he came from Iraq with a complaint of a 5 centimeter big kidney stone.
Where I am from Iraq, Mohsin Khalaf Al-Alwani. I complain of kidney stone. And when I read about the biography of the doctor and the operation achieved in India, well, he achieved 1,000 surgical operation of this bipercutaneous nephrolithiasis. So I satisfied with this doctor. So I decided at that time to go to India and to visit this doctor to perform what I need of the operation. So I reach India and visit the doctor in the Eurocenter Duty Hospital.
Now, to complicate the problem further, he had arrhythmias, he had problems with his heart, which had made the surgery a very high-risk surgery for him to undergo in Iraq. So basically, he figured out through various contacts of patients that I had operated in Iraq previously, and then he came to us with all his complaints of basically a big stone, a very, very large stone, which we could not see on the X-ray. It was only seen on the CT scan. And then we have to decide the best surgery for him. Because he had a heart condition, we had to do it fast, we had to do it completely because we couldn't have options of multiple surgeries for him. And then we chose a PCNL for his complete clearance of the renal stone. So in a PCNL, what we do is we make a small hole in the kidney, and then basically we put in a nephroscope, or you can say an endoscope, and then we see the stone, we break into small pieces and we remove the stone. The problem with this patient in particular was that the patient was on blood thinners because of his heart condition, and we had to stop those blood thinners, which increased the risk of the surgery. Now in this, after a proper cardiology consent, after a proper evaluation by a cardiologist, we stopped the blood thinners for a few days and then we proceeded with the surgery. Since it was a 5 centimeter stone and we couldn't see it in the X-ray, so it was a very big challenge to completely clear out the stone.
The doctor is competent doctor, clever doctor, easy doctor, well managed with the patient, and every good character present in this doctor. I chose this doctor, Rahman Tanwar, among 100 doctors specialized in this domain.
Now after the procedure was done, we confirmed whether we have removed entire stone or not with an ultrasound, and then we also did a CT scan before we went ahead and removed the DJ stent of this patient. So ultimately we could achieve a complete clearance, 100% clearance of a 5 centimeter big stone. And this stone, mind you, was in all the calyces of the kidney, which means all the caves of the kidney, and we had to do about 3 punctures to completely remove it in one sitting. So I think that was a very challenging case for us, but with the kind of faith that the patient has come to us, I think it was imperative that we gave nothing but our best.
I call God to preserve this, and underwent the operation, and the good result operation. Everything went well. And no any problem. And now I am ready to discharge from the hospital with well-being, good health. Well, I call God to preserve Dr. Rahman Tanwar and his staff in the Euro Center.
So the Middle Eastern populations, they have a higher incidence of uric acid stone. Uric acid is a substance which is an amorphous substance, and we all know about uric acid being high in the blood. It causes gout, but at the same time it also causes the kidney stones. And the problem with uric acid stones are that you can't see them on X-rays, you can't break them with lithotripsy, so you have to do something invasive typically to remove these stones. But also a good point is that even with medicines you can prevent uric acid stones. It's just that you need to know that you have a tendency to uric acid stones. And the other good thing is that when we analyze the stone for this patient, we can now give some medicines to this patient so that the kidney stones don't form again and again. So not only do we treat the patient by surgery, we also try to ultimately give a permanent solution to the patient as to why the stones are forming and how to avoid any recurrence, or if not avoid, at least delay the recurrence of the kidney stones.